Hi, I'm Brent Stafford, and welcome to another edition of RegWatch by RegulatorWatch.com. Over the past decade, tobacco control has waged war on vaping. They've demonized, taxed, restricted, and banned nicotine vaping products. They've misrepresented science and misinformed the public, all in a misguided effort to eliminate nicotine use entirely. Instead of helping smokers switch, tobacco control fights to stop them. But now consumers are leaving tobacco control behind. According to Goldman Sachs, in the United States market, sales of safer nicotine products will overtake combustibles in 2025. Tens of millions of Americans are switching, and in a shift that can only be described as tectonic. Joining us today to discuss the seismic realignment underway in U.S. nicotine use is Dr. Charles Gardner. A key figure in tobacco harm reduction, Dr. Gardner has challenged prohibitionist orthodoxy, exposed junk science, and worked to advance evidence-based public health. Dr. Gardner, welcome back to RegWatch.
Thank you, Brent. I'm very happy to be here.
Well, let's start with, what can only be described as a tectonic shift. Again, according to Goldman Sachs, in 2025, safer nicotine products will surpass combustible cigarettes in the U.S. in volume. Charles, how big of a deal is this?
So cigarettes are the number one cause of preventable death in every country in the world. In the United States, they cause 490,000 deaths every year. And so if there's something safer, we actually ethically should be actively encouraging people to switch to that safer thing. The data from the UK shows at least 3 million people have quit smoking with nicotine vapes. Now that's only one of now a multitude of safer nicotine alternatives, but it's the most controversial. So I assume we're probably going to be talking a lot about those. In the United States, my estimate is 9 to 10 million Americans have quit smoking with nicotine vapes. This is a massive tectonic shift. The number of American adults who were using those nicotine vapes at the start of the last decade was less than 1 million. It's at least 18.5 million now. And I'm using the most conservative of survey estimates. There are other estimates of 19 million, 20 million, and even 22 million adults are using these things. So adult nicotine vaping went way up, and then adult smoking went way down from about 46 million down to where it is now, which is 25.7 million, according to the CDC's National Health Interview Survey. If you look at that, if you graph it, it's basically a one-for-one product substitution, which is what we would expect if product substitution is happening, if these things are displacing the deadly products which we know of as cigarettes, combustible cigarettes. In fact, I've often kind of joked that if I just changed the labels on the graphs to sales of electric cars versus combustion engine cars, that everybody would understand what's happening. Or sales of digital cameras versus film cameras back in the 1990s. But for some reason, public health is extremely reluctant to admit the remote possibility that product substitution is happening. So what they'll tell us is, cigarette smoking is down, but e-cigarette use is up. So this is the whole sentence is a deliberate effort to try to disconnect cause and effect.
I definitely want us to run into that because that is the problem. We just finished an interview with David Sweener, who provided RegWatch a bunch of the data that we're using today, and then you did as well. There's tons of charts. And Altria also provided some of the data just through their 2025 Q1 earnings report. Let me do a little bit of a quick breakdown here on the size of the U.S. nicotine, the non-combustible nicotine market. In 2025, it's estimated that total sales of safer nicotine products are 30 billion. That breaks down to 25 billion for e-cigarettes, both legal and illicit, and oral nicotine is pegged at 5 billion. So let me ask you, Dr. Gardner, these stats, they're based on volume. What's the distinction there?
So we have to distinguish, those dollar amounts from unit sales from use. The use numbers we can get them from the CDC, from the National Institutes of Health. It's kind of awkward to say this, but the sales numbers that I look at, although the CDC has done its own analysis of unit sales just of nicotine vapes, and I've used that extensively. The sales numbers from the tobacco industry are probably more reliable than the numbers that we're getting now from government agencies, in particular now because the current administration has just killed most of the surveys of adult use, and of teen use. So we're now flying blind. The tectonic shift that you mentioned is truly alarming for a lot of people in the tobacco industry. But Goldman Sachs, I trust them. They know the sales numbers. They have the best access to the data. And what Goldman Sachs is saying is that this year, 2025, this is the year that safer nicotine alternatives sales are going to surpass sales of deadly combustible tobacco cigarettes. Now so those sales include e-cigarettes, but also products like snus and nicotine patches and a few others. My analysis of the CDC data shows that just nicotine vape sales are going to surpass US adult cigarette sales probably in about 2 or 3 years. So this is tectonic shift. And what's truly troubling is that the media is not reporting it. The media is obsessed on teen use. And our own health officials are really not trumpeting what you would think is super important news, given the fact that cigarettes continue to kill somewhere around 490,000 Americans every year.
When it comes to tobacco control, and we've discussed this before, you and I, and with others on this show, is that at some point, right, there is a tobacco control industrial complex, and that's funded by the cigarette industry. And so many states actually are also funded by the Master Settlement Agreement. At some point, it's not in their best interest to have smoking go down to zero.
So right now, the product class that is being demonized is what is being called in the press illegal Chinese vapes, right? So what these are is illegal flavored disposable nicotine vapes. More than 9 out of 10 Americans who are using those products are adults, not teens. There's a very well-funded effort to convince the public that most of the people who use those products are teens, and that they only exist to lure teens. We're talking 10 to 13 million adults using those products. And so then, okay, who wants to get rid of them? Who wants to remove them from the market shelves? Obviously, the Campaign for Tobacco-Free Kids and Parents Against Vape, the Truth Initiative, and many others. who else wants to get rid of them? Two of America's biggest big tobacco companies are on record talking to their investors, saying those are the products that are undermining our cigarette sales. So we have some very strange bedfellows where this is like Baptists and bootleggers, going back to the 1930s, where big tobacco wants to get rid of them. All the anti-vaping organizations want to get rid of them, but for entirely different reasons. And, ironically, Campaign for Tobacco-Free Kids is now promoting policies that will help big tobacco.
Another major standout is the growth in adult vapors in the U.S., and we've been talking about that. According to Altria's 2025 Q1 earnings report, quote, in 2024, there were 18 million vapors in the U.S. Today, that number is 20.5 million, with 14.5 million using disposables, most of which are illicit. So now, this is amazing that this market keeps growing year over year. But of course, a huge chunk of this market, and I believe the number is around 60%, is what Altria said, is that are disposables, and the majority of them are illicit.
The unit sales analyses that I've seen show that sales of disposable nicotine vapes have basically tripled over the past 5 years. And if you track that back to 2020, which is when the first Trump administration ordered the FDA to prohibit sales of flavored pod-based vapes, what happens is sales of the pod-based vapes suddenly starts to drop, and American adults who were trying to quit smoking shifted basically en masse and voted with their wallets and their pocketbooks and shifted to flavored disposables. I remember walking around Manhattan in the 2018, 2019 time frame. I saw adults everywhere were vaping, very often with a Juul. And when I would ask them what flavor they were using, it was always mango. And now I have to say I see a lot less adults vaping. So this is anecdotal but this is on the street. But every time I see one, and I stop and very politely ask, what are you vaping? Do you believe this is safer than cigarettes? But I would say half of them say no. So they're misinformed. They're almost always vaping disposables. And so there's been this massive shift that is caused by a prohibition back around 2020. And so that you get the skyrocketing sales of disposables. But all the while that was happening, sales of disposables were tripling. Teen nicotine vaping was dropping 70%. This is not up for debate. Teen nicotine vaping dropped 70% over the past 5 years, and adult nicotine vaping increased 85%. And there are, by the way, 10 times more adults than teens. So you could work out the numbers. And so it's another tectonic shift, but it's kind of a massive, another example of just prohibitions distort the system, almost always do not achieve the goals that were intended.
Dr. Gardner, were you surprised to see this shift happening with the fact that, safer nicotine products is on the verge of overtaking combustibles in the U.S.?
Yeah, I'm actually very surprised, primarily because somewhere between 2/3 and maybe even 80% of Americans who smoke cigarettes, who smoke deadly combustible tobacco cigarettes, believe incorrectly that nicotine vapes are as harmful as those cigarettes. So, so how this is happening is kind of baffling to me. But it's a good. I think it's a good thing. And I think the dramatic decline in teen nicotine vaping is also a super good thing. You will find that among ex-smokers who quit by vaping nicotine or with other safer nicotine alternatives, they're the staunchest opponents of teen use of nicotine. Because why? Because teen nicotine use leads to draconian, knee-jerk, evidence-free policies that will literally kill us. So we're kind of opposed to that. And like every indicator you can think of is moving in the right direction now. But obviously, you would never know that if you read the media. In Texas, they basically send kids caught vaping to re-education camps. So it's an overreaction. It's an irrational moral panic. But I think, and I've given this a lot of thought, because all the surveys show teen nicotine vaping dropping dramatically over the past 5 years. But that's not the perception that school officials, teachers, and principals have. And some of their perception is influenced by the propaganda that they hear, and that they have campaign for tobacco-free kids coming in and telling them this is a crisis, and parents against vape coming in and telling them this is a crisis. But it's also that they are now hyper vigilant. And a lot of schools are now chock full of vape detectors, which have been purchased in a kind of major scam by the Juul settlement, which is nearly $500 million. So a lot of that money has gone to buy vape detectors, and the manufacturers of those vape detectors are cashing in. So the schools are full of vape detectors. The teachers are hyper vigilant. So this is, in science, this is something called observation bias or selection bias, right? So if you're the sensitivity of your detection has just increased dramatically, you're going to catch more incidents, even while the number of actual kids vaping nicotine is going down. So the perception hasn't changed. It may take a while to catch up. But one more thing. A lot of teachers and principals and school officials, they don't know how to distinguish between a nicotine vape and a THC vape. We know that nicotine vaping has gone way down, and THC vaping, according to the National Institutes of Health's Monitoring the Future survey, didn't really drop very much, and if any. And so there are some indicators that actually teen THC vaping may be on the increase, but I've seen no definitive survey data on that. So there was a survey that came out quite recently that showed 2 out of 3 devices confiscated in schools were THC vapes, not nicotine. And I think a lot of that is going on as well. But meanwhile, everything gets blamed on nicotine vaping, and leading to these kind of draconian policies, which give no thought to what effect they're going to have on adults.
So, Dr. Gardner, we have this seismic transformation going on in the U.S. nicotine market. Combustibles are on their way out, and that is for certain. So let me ask, can you point to any interventions that public health did and tobacco control did to help facilitate this seismic transformation?
Well, if you look at the smoking rates in the United States. Uh, the U.S. Surgeon General finally informed the American public that cigarettes kill people in 1964. And there's a bit of a lag time, maybe 4 or 5 years. And then we went ahead and we prohibited all tobacco advertising, cigarette advertising. And so maybe some combination of the two of these things, just informing people that this will kill you. Like, Americans are not completely stupid. Like, and Canadians are even less stupid, Brent. And so cigarette smoking, cigarette sales, both began to drop in the late 1960s, and they've been dropping at about 2% per year for decades. And then suddenly, excuse me, suddenly they started dropping at 5% per year. And then now they're dropping, according to Goldman Sachs, at 10% per year. So something has caused a seismic shift, right? So this has never been happening before. It is the end of the age of smoking, and almost nobody knows about it yet. They will. I mean, eventually it's got to sink in at some point. And if you just project the trend lines forward, nobody's going to be smoking in the United States in about 9 years. So that said, the remaining people who smoke are primarily low-income people, or American veterans, or Americans with mental health issues, or unhomed Americans, or Americans who are using illicit drugs, or Native Americans, or our First Nations people, our indigenous people. And like basically any vulnerable community you can think of, they're far more likely to smoke than people who look like me. And I have to say that there's a great lack of sympathy for that while we're in the process of stigmatizing people who smoke.
So I guess the heart of my question is that it comes down to the fact that it seems that tobacco control and public health and regulators in the U.S. have done everything they could to stymie this shift, to demonize, ban, protect. So my question was to try to provide you an opportunity to be generous towards these people and these government officials and give them some credit for what's happened in the last 10 years. I've got none for them, but I was giving you a chance to give them some credit, but maybe there's no credit due.
So if you look through the 1970s, 1980s, 1990s, what did tobacco control tell us to do? Ban things and stigmatize people who smoke. We banned cigarette smoking on airplanes. We banned cigarette smoking in bars and restaurants. And all of that was supposed to, and a lot of other policies were implemented supposedly to reduce smoking. If you look at the trend line, none of those things had any visible impact on the steady 2% decline in cigarette smoking in the United States. So I sometimes I just wonder if these kind of policies are punitive, are just people in the field of tobacco control trying to make their careers and their recommendations relevant, and because they can generate scientific studies that show that prohibiting smoking in bars and restaurants will reduce smoking, but the trend line doesn't really change. Like, if you're looking at the population level, the only time we've started to see that trend line truly change is over the past decade. So and obviously people in traditional tobacco control or old school tobacco control, they had nothing to do with that. They didn't invent this. There's the old phrase, not invented here, or NIH syndrome. If you didn't think of the solution, but the solution is working really well, you might be uncomfortable with that, right? And there's, I mean, the obvious other issue that if adult smoking drops to zero, as I think it will in the next 10 to 15 years, teen cigarette smoking has already dropped to near zero. Daily use is basically nil. Our surveys of teens used to ask how many packs of cigarettes you smoke every day, and they've dropped that question long, long ago. Teen smoking has dropped to near zero. Teen nicotine vaping is now at a 10-year low. Well, okay, so why do we even have this field of tobacco control? That's really blunt. I am in the field of tobacco control now, but I think we need to question the priorities, and I think obviously I think we're on autopilot right now with 1990s priorities, and nothing has been reassessed based on evidence, taking into account what's happened over the past 10 to 20 years.
Does it take something like, say, the Trump administration coming in and just annihilating entire agencies and funding to make that happen? Or is there some other way in which tobacco control will mindfully change their tactics and maybe their job?
Brent, I'm not sure that just coming in and breaking things and hoping that comes out better in the end is going to be the best, is going to lead to the best outcomes.
What about the FDA? Now, obviously, they're going through some changes and so forth. We don't really know yet how that's going to shake out. But what does this change that we've seen happen say about the current FDA strategy? Because they only got a handful of products that they've authorized under this PMTA system, but yet, 2.4 million more Americans have switched to vaping in just the last year. We're over 20 million. Like, at some point, are we going to be in a world where the regulators and tobacco control are going to try to force 20 million Americans to stop vaping?
Brett, it's only about 15 million. So they're going to go after and wipe out all of the disposables, and that's about 15 million adults. And, they wipe them out, and then when they start to see cigarette smoking increase, and big tobacco gives them a big thank you, there might be some reassessment. So they're going to go after what they think is a low-hanging fruit, exactly the same way 4+ years ago, the previous administration went after flavored pod-based vapes, and there are going to be massive unintended consequences. I have no optimism about the logic, the ethics, and any kind of evidence-based drive and focus to the policies that are going to come out in the next 1 to 2 years from FDA or God, heaven knows, what's going on with CDC.
Just in the last couple of weeks, FDA Commissioner Dr. Martin Makary told Sean Hannity live on Fox News that the agency is focused on cracking down on illicit disposables, even referencing armed enforcement actions. And it goes right back to the whole, demonization around these Chinese disposable vapes. So given that we're in this huge realignment, is there any chance that FDA might prioritize continuum of risk, tobacco harm reduction, or are they locked into this enforcement policy, which they seem to be?
I think they're going after a political objective that they think will test well in, in voting groups. I, the the fact is, the people most happy if McCarry succeeds in doing that are going to be big tobacco and Campaign for Tobacco-Free Kids and Parents Against Vape and the Truth Initiative, because they also are basically operating on autopilot. They all decided several years ago that flavors are evil incarnate and can only exist to lure teens, and so they've just got to get rid of flavors. And again, they're not going to give up on that. We have survey after survey from the CDC showing that flavors are a very low priority for teens in terms of why they say they chose to vape, and we have a massive decline in teen vaping. But flavors, they've got their teeth sunk into it, and they're not going to let go. So, and flavored disposables are basically for the average person who's buying a vape at a gas station or a bodega or a corner store. That's where the flavors are going to come from. And proper vape shops, as we used to know them in the 2019s, 2018s, and earlier, those are becoming fewer and far between, which is a shame because they have been helping millions of adults quit smoking.
Yeah, it does appear that the independent vaping industry in the U.S. has been hollowed out.
Something remains. I mean, I do talk to people in industry, even though I'm not in industry, and the same ethos remains. We actually want to help people quit smoking and not die, and none of us want teens to use these things. And we're kind of sick and tired of being accused of wanting to lure teens into a lifetime of the horrors of nicotine addiction and all of that standard propaganda stuff. And there's a great deal, both in terms of the community of millions of people who have quit smoking with safer alternatives and in the safer alternative industry. There's a great deal of burnout and frustration, and we really need to shoulder on here. We need to soldier on. We need to soldier on here, and because we are going to win eventually, because the evidence is on the side of harm reduction.